Hey guys, and welcome to my channel. I decided I would go ahead and get on here and do my follow-up video from the hip surgery story that I did like a year ago. It was like almost a year. Um, in May of last year was when I had my revision surgery, and I posted that video about my story. And I've had a few people kind of reach out and say, how are you doing now? And kind of like a little bit of an update. So first of all, I just wanted to apologize that I didn't come back right away and update. Life kind of got a little crazy. I did have to go back to work a couple weeks after that second surgery. Um, and then I found out that I had a second rotator cuff tear. It also involved the bicep as well. So I'm actually 7 weeks out from rotator cuff surgery right now. So I'm off work again. I do go back in like a week. That's a whole another story. I'm not going to get into that. They do think that I probably have some sort of hypermobility disorder or something like that that's causing all these things with my joints and that kind of thing. But to kind of back up, if you didn't see the very first video that I did about my FAI, which is femoral acetabular impingement video, my very first surgery that I had with that was like 2 years ago in May. And then after that surgery, I had a lot of difficulty in PT. I was losing range of motion, that kind of thing. And then it led him to me getting more imaging about 9 months later. I think it was like 7, 8, 9 months. I can't really remember right now. But that's when they found out I had adhesive capsulitis, which is basically like you can have adhesions after you have any kind of surgery. Scar tissue basically is what it is. But in my case, it had just developed like around the capsule of the hip joint, and that was what was creating all the stiffness and the pain, and it wasn't letting me rehab correctly. So, and that could also be because of the disorder that I'm dealing with right now with the hypermobility, genetic, like collagen, connective tissue. Like I've got something going on in my body because I'm only in my 30s. I have not had any injuries, although whenever I was younger, I was very like athletic. I was in a lot of sports, that kind of thing, but nothing that they can pinpoint and say, like I did not have an injury. The FAI was deemed to be from like congenital, so born with it, and it just as I gotten older, it tore my labrum, that kind of thing. So sorry, I'm trying to not be like all over the place with this video. I'm trying to do the best I can with explaining things. If you've seen the first video, it kind of explains a little bit more about my first surgery. But so with the second one, I had May of last year. They went in to clean up the scar tissue, the adhesions, all of that. The my labrum. Oh, excuse my dog. I'm so sorry. She does that stuff all the time. It's so embarrassing. Lily, stop. But sorry. But anyways, yeah, I tried to film this video all the time, and then something like that happened. So just bear with me. But anyhow, they went in, last May, and he really didn't know what he was going to be faced with until he got in there and seen it, in the surgery. So basically, they released all the adhesions. My labrum actually looked fine. The original MRI kind of thought maybe I was dealing with some more labrum issues, but it turned out to just be like because I'd had a previous surgery and that kind of thing. So they went in and cleaned that up, and they actually injected my joint space with stem cell treatment, which is like through like placenta, like a placenta stem cell treatment, and it's supposed to prevent more scar tissue, more adhesion. Since I'm already prone to that, and I was having another surgery, they kind of wanted to do that. So then just fast forward, I had the surgery, like the recovery was good. The first few weeks, again, just I noticed like even within the first few weeks being able to like move my leg a lot better, like my range of motion was a lot better. I was walking better. It just needed all that stuff to just kind of be broken loose in there from the adhesions. Um, and then I was going back, doing physical therapy again and all of that. So, but still dealing with a little bit of pain and discomfort, which I knew that would, take some time to kind of, that just after surgery, it takes time. But now I'm almost a year out from the second one, and I'm actually still having quite a bit of difficulty. A lot of it is still stiffness and pain in my hip. They did say that I had arthritis, like a little bit of arthritis in there when they went in the first time. So it's a lot of it's going to be like because I have like just a crappy joint anyways, and I have a little bit of arthritis going on. Because I actually just went and seen them a couple days ago. Since I've been off for the shoulder surgery and I've just been laying around, I've noticed like a pressure, like a really painful pressure in my hip, and I'm not laying on my hip. I try to get up and be active as much as I can, but it kind of worried me, so I called them and they're like, yeah, that doesn't sound normal, go ahead and come in. They did an x-ray. Well, according to the x-ray, everything looked fine with my bone. She thinks it was just like probably a lot of just soft tissue, muscles, and tendons just kind of flared up from me being off from the shoulder surgery. So I'm going to be doing a more PT on my hip. Basically, it was a little bit sad because she's basically telling me like you're never going to be like 100%. Like I think whenever I went into the surgery, I thought, oh, they're just going to go in and they're going to fix this. I'm going to rehab, and maybe it might take a little bit of time, but I'll be back to normal and I'll be back to myself. Like I think the mistake I made was I didn't ask enough questions. I just thought it was just going to be like a simple fix. And, everybody's different, and that's why I really want to reiterate in this video, as I did in my first, that, you've got to be, your body is going to be different, and you got to be, communicating with your doctor, and your doctor is going to know the best treatment plan for you. So not everybody's going to have the same story and the same outcome. But in my case in particular, and especially and I might be a little different because I have, like I said, crappy, like, connective tissue. But, I just kind of like thought that, oh, this is going to be like, going to fix my hip and I'm going to be better and everything. And now to be told, like, you're going to have to deal with this the rest of your life. Like, you're going to have to deal with, the ups and downs. There's going to be good days. There's going to be bad days. This wasn't a complete 100% fix. Am I better than I was before the first surgery? To some degree, yes, because prior to the first surgery, I could not even put weight, like barely even put like a lot of weight on my left side of my hip. Now I'm a lot better with weight bearing, but then I feel like it's kind of irritated some other things too. Like I have like an IT band, like I have pain that's not just in my hip. I have it, down my leg, in my lower leg, like it just kind of spreads all around. I have like back issues. I mean, a lot of it is related. So even though it's like hip, it's and I'm sitting, so I'm sorry, I'm gonna have to scoot a little bit. I don't know why I choose to sit on the floor. It's because I don't have a grand setup or anything here, so just please again apologize. Just bear with me. But yeah, it's just going to be one of those lifelong things that I'm going to have to deal with and try to get through. So, to answer questions about how I'm doing now after the revision, I would just say that I am better because after the first surgery, again, because of the adhesive capsulitis, adhesions, and the scar tissue, I couldn't walk like very, very long distances at all, and it would just freeze up, and it would be, pretty embarrassing. Like, I'd be in public, and I'd see, older people, like literally like 80-year-olds getting around better than me, and people would just like look at me like, almost like, like concerned and just, I don't know, it was embarrassing. But now, I mean, I can walk longer distances without my leg getting, again, like tense, locked up. But I still am dealing with pain, stiffness, range of motion issues, and stuff like that. And it's just going to be a long, a lifelong thing that I'm going to have to continuously rehab, um, continuously do my PT. I think right now, again, it's just flared up because I had the shoulder surgery and haven't been as active. But that's the thing with this. It's like, if I'm too active, then it's almost worse. So it's like, I kind of have to find a middle ground. Like, I can't be too active, but I can't be, underactive either. Like, I have to find that happy medium. And I think that's what a lot of people will find, after dealing with this kind of surgery. Even if you have the surgery and it's a complete fix, a lot of people do have that. Mine is just a little bit unique because, again, of my hypermobility disorder, that kind of thing. I don't know. It's just never really going to be 100%. But, again, everybody's different, and I just encourage anyone watching this. Lily, please stop. I'm trying to do a video. You're being rude. I tell you, it never fails. But anyways, just, really look into researching this for yourself. And, but I'm doing okay. I'm just, a lot of it too is just your having a positive mind frame, and, really not trying to, like, let all of the stuff gets you down, because I mean, the mind-body connection is so strong that I was finding myself kind of in a spiral, if you will, to where I was just thinking, I'm just never gonna get better, so what's the point? You just kind of get in this negative mind space to where, it's not good. It's not good for you. It's not healthy. And so, I mean, the more, like, positive that you can think about your situation, that, yeah, even though, like, right now I am never going to be 100%, that's okay. Like, I mean, at least there's things that I can do to make me, 90% or, 80%, whatever. Like, it doesn't mean, like, it's not the end of the world. I mean, I'm not, it could always be worse, is what I'm also trying to say. Like, I've not been given a diagnosis that I'm terminally ill or anything like that. It could always be worse. So always think about that. Like, even if you're suffering and you're in pain and you're going through things and you're just not really sure, what the outcome is going to be, just, always remember to just stay strong emotionally as well, because, that really can affect how you do. So I'm rambling at this point. I don't know. I hope I answered, some questions. If you are going through this, if you are one of the ones that kind of reached out and said, hey, do an update, thank you for requesting that, and I'm so sorry that it's taken me so long. Like, again, it's just, things have just been a little bit crazy. But yes, if there's anything, I can answer for you in the comments of this video, please leave them down below. And again, let's just reach out and kind of advocate for each other, and, be there for each other, and try to help in any way we can. You do have to go on your doctor's advice. Do not take anything that you see or hear or read on the internet. You really need, your doctor knows your body the best, so you have to be, very careful with that. But, I think this is a good place, kind of like a support kind of place, where people can tell their stories and say, oh yeah, that happened, or, oh, that was different for me, and that kind of thing. So that's kind of like what this is about. And so yeah, I'm hanging in there, and like I said, still recovering from the shoulder, but I will hopefully just keep pushing on. That's all I can do, is just staying positive, and I encourage you guys to stay positive as well. Again, thank you so much for taking the time to click on this video, and I hope that it was helpful in some way. And sorry it was a little rambly all over the place. I just thought I have to get this video recorded and up. And please let me know your questions and comments down below, and I will talk to you soon. Thank you so much. Bye.